Hello.
Oh, good afternoon,
Good
Dr. Muhanna.
afternoon. Oh.
I'm very happy to see you.
Mm.
So we, at Viva Salud, we have three partner countries, the Philippines, Congo, and Palestine. And for Viva Salud, I am the one working on Palestine. First question, first of all, how are you feeling? How are you doing?
Yeah, I'm trying to be okay after the hard period in my life. It was a long period for me and for my family and for my friends and for my colleagues. Really, it's a new experience for me. As you know, 52 years I have now, and I never I didn't expect that I will pass in this hard period,
Mhm.
especially in the special conditions in the prisons, new conditions in the Israeli prisons. They take a lot of procedures against the Palestinian prisoners, and all of them unhumanitarian, actually unhumanitarian, and they affect our health first and our psychosocial aspect second.
Yeah.
Yeah. um, this is يعني in general, as but there is a lot of details, of course. I can share with you some of these details from the first day first when they arrested me from my hospital in Al-Awda in northern area, 17th of December. They came to the hospital 16th of December 2023, and they asked me as director of Al-Awda. They told me that you will go with us. I asked where. I am here in my hospital, in my job, and I have a patients, I have a staff, but I can collaborate. I can. What you need from us here in Lauda? They told
Mhm.
me you should come with us today, and tomorrow morning we will come together with other delegation from the security agency of the army, Israeli army. I said, okay. They put the rings on my hands and the tie on my eyes, and they take me on one of houses, civilian houses, around the hospital, about 300 meters away from the hospital. And I spent all the night in this house, and early morning at 8 o'clock morning, we came together with the delegation from the security Israeli army, and they told me that we will not cross the hospital. uh, just we need to extract all the stuff from the hospital outside. We want to see everyone. I told I have patients, I have staff, and I have people, civilians who came with the patients, and some children, our staff. And I start through my assistant evacuate the people, especially men, from 16 to 60 outside, and they ask me that you should tell them to take off the clothes up to the underwear. It was very cold, actually. I tried with them to accept the elderly and the childs, but they refused that. Everyone. I go, okay, and start evacuate groups 2020, and they start investigations with the people, all the peoples, staff and others, and even patients. They told me that even mobile patients who can come, they should go out. Okay. And after I gave the list, all the people who is inside the hospital, they told me, we need this one. I told this patient cannot come because he has amputated leg above knee. They told me that should come.
Mhm.
I asked my assistants to sit them on the chair, and two persons they will give us to mobile him, and they arrested him actually, and they arrested another three-person staff, one nurse and one security and one ambulance driver. And 5 o'clock p.m. they told me that we finished. We will not cross the hospital. It's okay. You can continue your activities in the hospital, but no one should go out of the hospital. No one should looking through the windows, because they shoot the five medical personnel inside the hospital and was dead five. Three doctors, one hygiene, and one nurse. And they told me that you should come with us also. I go, me? They told, yes, you should come. Some of them want to drink coffee with you in Tel Aviv. I go, coffee? It's okay. Let's go. And they take me on checkpoint areas on the border, and it was 2 o'clock a.m. And after that came the bus with the transport soldiers with the covered face, you know. They came and they take me and they start beat me on the flanks, and they make a fracture rib on the right side first. I cannot understand why they are doing that with me. And they take me to the center around the Gaza, about 30 minutes from Gaza. It's called Sidi Timan, I think. I stay in this center 24 days. It was very long and hard days, 24 days. No sleeping, no eat, no rest, no investigations all the time. And they it was the physical abuse and psychological abuse, and they pressure make a big pressure on me, you know. Start ask me questions, different. It's stupid questions like, you have military in the hospital, you have tunnels in the hospital, you treat soldiers, Israeli soldiers in your hospital, you have dead bodies, Israelis in your hospital. I told every all of this, it's not true. I'm civilian hospital. We treat ladies, pregnant, child, and you saw by eyes your soldiers, the hospitals from inside through camera, everything. And I gave you your commands. I gave the server from cameras in the hospital from 7th of October, so you can see each one, everyone who's came to the hospital. I gave you the documents. Blind, no one listening. And after that, they ruled me to the other prison. It's called Ketziot. And I spent in this prison 1 year. First 6 months was very hard, no nutrition very poor, no medical care, no hygiene, nothing. And the prisons, the guys start diseases, skin diseases, start itching, and start the immunity decreased immunity and start infections, abscesses all over the bodies. And I start do management for some simple cases of our colleagues because it was lack of the medical care. Absolutely no, nothing. When I'm asking, I'm doctor, please give us antibiotics, give us a gauze, some polydine, antiseptics, anything, tools, anything. I will do it that for my colleagues. Give me. You are not doctor here. You are mechabel in the Israeli word, terrorist. So I start work with our colleagues with the initial elements, instruments like electrical cable and through the rubber, and we take the metal and through the pole we start do anything to open the abscesses and that traps. We did like gauze, and we start use the chlor, HCl, chlor, as antiseptic. No, what can I do? After that, they move me to other prison. It's really the condition was more worse. So no toilet, no shower. We just have a bath. The bath, you know, I told that I need toilet. Yes, go ahead. You have something. Open that and do it. We are 38 person in 50 square meters. How? It's not enough even. It's your problem. Do that. Go away. And a lot, hundreds of exemplars, hundreds. This is in shortly what I had my experience in the prison. Please.
Yeah, thanks for sharing. It's very hard to listen, I have to say. It's gruesome. But yeah, I'm very glad you're safe now. I'm very happy to see you. But why do
Sorry,
you,
I lost 30 kilograms from my weight because it was very, very poor nutrition, not enough at all, just for kids, 6 years, maybe even not enough. The amount of food per 24 hours totally. So we eat just once a day. We collect the food morning and evening, the day, midday and evening. We collect together just to eat and to feel that a little bit satisfaction. I am full. That's it, you know. And no, the kind of food, bubbles, not well cooked, no salt, no fruits at all, sugar no, free at all. And it was really a catastrophe. And the system that every day the same, every day the same, you know, it's a schedule, the same from day first up to last day, the same schedule. Yeah, please, sorry for interruption.
no, thank you. And how was your daily schedule looking like, starting in the morning until the evening? Is it like, can you go outside? Or are you just 24/7 in the same room?
No, 38 person in 50 square meters, and we cannot move away. They bring the food in the containers, and from each room, one go and take amount for example, you see that? You see?
Mhm.
This is the amount of rice for me for lunch. And
Yeah.
fasul, like that. That's it. 2 slides of pomidor, thin slides of pomidor, and thin slides of melon. That's it. It's for lunch.
Mhm.
Or morning, 2 spoon of yogurt, 2 spoon for each yogurt, and 3, 4 slides, thin slices of melon. 2 pieces of bread, thin slices of bread for each meal. 6 slices of bread, thin slice of bread for 24 hours.
Okay.
The
Yeah.
rice, the rice, not well cooked, not salt, without any spices, without anything. So we put the rice in the water and in the sun for 2 hours just to make it a little bit softer.
Wow. Okay. And why do you think that they are targeting healthcare workers such as you? Why is Israel specifically, or why did they specifically arrest so many doctors, nurses?
Yes, because they are thinking that the doctors treated the militaries and they are supporting, like if they are treating the militaries, so they are supporting the militaries. So they are included with military forces, Palestinians, I mean, Hamas. They are treating the Israeli soldiers, uh, but actually, in the governmental hospital, maybe something like that happening. But
Mhm.
in my hospital, private hospital or non-governmental hospital, small hospital, we haven't refrigerator even for die bodies. We haven't, and I gave all the evidence for the soldiers and the groups who came to the hospital, all the evidence, and you see that by your eyes, and you have the servers, and
Mhm.
I don't know why they are dealing with us like that, even especially for me.
Mhm.
Maybe because I refused the orders to evacuate the hospital. I told that, yes, I refused because I had a patient, I had a child, I had a pregnancy, and where can I evacuate? Even the governmental hospitals destroyed it around. So where they can go? Let them die simply about 70 patients. I cannot permit.
Yeah. And were healthcare workers such as you treated differently in the prisons than other prisoners?
I don't know about other prisons, but in my prisons, I organized a group, yeah, me and nurse. He works with me with Al-Awda, and another nurse in the governmental hospital. And we rotated in the rooms and treated the guys as possible. I used my skills, and it was really difficult to keep our patients in good health, because then it needed antibiotics and a lot of medications, but they didn't give us anything absolutely. And I lost 2 of prisoners in the prison uh, due to the lack medical uh, treatment.
Okay.
I am so sad for that.
I can understand. And did you also get a lot of, I mean, you got a lot of mental abuse, but do you also get a lot of physical abuse in the prison?
Yes, yes. Yes. And even I have some problems now. Even I'm in the hospital now. I passed diagnostic and therapeutics procedures, and I'm waiting the results. But actually, till now, I have anemia. My hemoglobin 9, it's
Mm,
low, and I did ultrasound. I passed. Diagnosis of ultrasound. I have free fluids in the abdomen, and they are searching for something. We will go to the more advanced therapeutic procedures, even diagnostic colonoscopy for the intestine. I have over distension after each meal. This is
mm,
habit, this habit and discomfort, and it's actually make pressure for on the lung, and it make difficult breathing at the evening time. So I have a complex of complications. Really now, till now, I cannot return back to the work because I have a lot of problems.
yeah. Okay. And uh, when did you learn that you were going to be released from prison, and what was your first reaction to that?
I didn't know that just when the delegation of the Red Cross came to us Saturday, and they met us. They told me that your name in our list here, so maybe you will be evacuated soon. I asked when. They told me, we don't know, but we have your name, but we don't know. Okay, thank you. They make me announce the rules and what's will going on after that. But I, 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 s- I wait all the evening Saturday, all the day Sunday, nothing happens, and start worrying. Monday, 4 o'clock a.m., came a huge number of soldiers, a huge number, and they start evacuate us and put the rings on the hands and tie on the eyes and the rings on the leg, and they start beat us in the corridor, 20 soldiers and 20 soldiers, and they make a corridor, and we passing through the corridor, and everyone start with beat us, until reach the bus. And I sit in the bus 6 hours from 6 o'clock a.m. till 12 o'clock p.m. 12 o'clock, the bus moved to Gaza, and we reach Gaza at 3 o'clock p.m. And they take off the rings, and even in front the Red Cross delegation, they start beat us also. And when I sit in the bus following to the Red Cross, I start breathing, deep breathe. I take a breath. Yes, I am free now. And 6 o'clock, we reach the hospital, Nasser Hospital, and I met my family. I believe that I'm free. Just when I met my mother and my brother, my wife, my kids, it was wonderful. Yeah,
I can imagine. I can imagine.
yeah.
And how was it to return to the hospital and see your colleagues of Al-Awda?
It was warmful, really. It was warmful. It was good to see all the colleagues. They met me with happiness, and all of them, they came from all the governments, and they met me from the hospital. And I told that in my speech, that I return back, our colleagues, and I will return to the work soon. And actually, maybe someday I will officially work to my job, a new position.
New position.
Yes,
Okay.
director of programs.
Okay. Congratulations.
More hard work. Thank you, Drew, friend.
No, I'm very happy for you. But of course, right now they say we have a ceasefire. Do we really have a ceasefire right now in Gaza?
I'm not believing till now. Really, I'm not believing because it's a fragile ceasefire. I'm worried from Netanyahu side, from Trump side, because as a politic, Trump, he is crazy man. And Netanyahu, he is vampire.
Mm-hmm.
So that from this reason, I'm worried. But I'm I hope it will be continue because the people cannot tolerate more.
And what are the priorities right now for Auda and for the health structures in Gaza in general?
Uh, the priority to improve the health system in Al-Awda and to make our services more wide, to include even the mental health services and other advanced health services, to reach other governorates and to open more centers to reach all the people, suffered people from our nations.
Mm-hmm. And how can, or what do you expect from countries like Belgium, the European Union, the international community? What do you need most from them?
We are looking for more support from our partners first, and from the international community second, and the Ministry of Health third. More support, because we need that, and we are providing our services now for free of charge, and other services minimal charge, because the people, all of them, the poor people and no income, absent.
Mm-hmm. Yeah, I understand. Um, and today in this situation, where do you get, are you hopeful for the situation? Not for the ceasefire in general, but for the lives of the people in Gaza. What gives you
I'm,
hope?
I'm to be frankly, no. But I cannot say that for around people. I I'm saying that I have hope. We are looking for more beautiful future. Let's go to do that together. And but from inside, I'm worried. Really, I am worried about my family, about myself, about my colleagues, about my nations, my peoples, my friends, about everybody. I am worried.
Yeah, I understand. Yeah, I understand you completely. But is there anything you would like to ask? Because in Belgium, we had mass mobilizations. The people really here support Palestine and Palestinian liberation. Is there anything you would like to say to them? Ask them, to the people who stand in solidarity with Palestine?
The solidarity, the Palestinian people, they need more solidarity, especially from the decision makers in the politics positions. It's important. The people in the nations and Europe and Arab world, they are support our people here. Yes, thank you. But we need more support from the governments, from the political statements. This is what we are need now. Everyone, put the hands on the eyes and on the ears, and I don't
Mm-hmm.
care,
Yeah,
because they don't want to make Trump angry or Netanyahu to be upset. This is the reason now.
yeah, and how difficult is it at the moment to provide medical care for your patients? Is it possible? How are the medicines? How is the medical equipment?
Yes, absolutely. We have shortage in the medical supplies, and we have shortage in the medical equipments because we opened a lot of centers, and there is in our local markets, there is no medications, there is no equipment, and there is even I'm searching now for refurbished equipments, even I cannot find. So it's a really a challenge. It's a big challenge for us.
Okay.
And we need good support in this direction.
Yeah. Well, we're trying to help here.
We hope Viva Salute all the time, a strong and a good our partner, and we believe in your aims, and thank you for your efforts. According to the projects passed with Al-Awda and Viva Salute, the hundreds of people, it was useful really through your programs, and we are looking for more cooperation from your side. Sir.
It's our pleasure.
Thank
It's our pleasure. I have to say hi from the whole team to you, because we've all been following, and on Monday evening we all saw the videos when you were released, and by accident we were all together that evening, so we celebrated your return to the hospital. So the whole team was really living with you in that moment. Yeah, I think I have asked my questions. Is there anything you would like to add, or you would like to ask me?
Keep your support to Al-Awda stronger and stronger, because we need your support. Viva Salute. You are good friends as organization and as members.
Thank you. We will definitely do that. Okay, I'm going to let you go. Thank you very much for your
Thank
time.
you.
Very
Thank
nice
you.
meeting you and
It's
talking to
nice
you.
to meet you and to speak with you and to open this discussion. And I hope maybe sometimes we will meet here in Gaza.
Let's hope so. I hope
I
it's as
hope.
well.
Thank you.
Thank you very much. Have a nice day.
Thank you.